beautiful people. I'm back again, and this time I'm here to share some study tips that helped me to pass my Nclex. These tips can also be used to help you in any nursing exam. So let's get right. Tip number 1 is to understand your learning style. Some people are visual learners, some people are auditory learners, some people are hands-on learners. So it's very important to it's very important to understand your learning style and incorporate that into your studying. For an example, if you are a visual learner, you need to see how things work. If, for example, you need to understand how blood flows. There are some people who can just listen to the lecture and they understand. There are some people, they need to see an actual image. They need to see the heart. So when you see the heart, you can understand that, okay, blood comes from the super vena cava into the right atrium. You're able to see it, visualize it, and that helps you to understand. So it's a very crucial tip, is understanding your learning style and incorporating that into your studying. Okay. Tip number 2 is to purchase one Nclex book. The reason why I say one Nclex book is because I realized I had several Nclex books, and oftentimes I'll be confused, not because of the material, but it's just too much information. So it's good to just have one Nclex study book, the one that it gives you the key points of each subject. So we'll go by maternity, pediatrics, psychiatric. It gives you the key points in each subject. And it gives you study questions at the end of it. So just purchase one Nclex book, study book. I think the one that I used was Saunders. Saunders really helped me. So I just used that to help enrich my knowledge base. And so I had my own notes, but that also helped to condense the information, so I'm not just studying a whole bunch of things that are not going to be necessary for the exam. So it's important to just purchase one book, because you are going to have a lot of material that you have accumulated throughout your nursing school. So there's no need for you to buy 5 Nclex books. Which leads to my third tip, is to make sure that you keep your notes organized and keep your notes in one area or in one space. The reason I say this is because what really tripped me up was that I had information in different places. I had notes in my laptop. I had notes, handwritten notes in my notebook. I had notes in my phone. Like, I just had notes everywhere. On top of that, I was also using all these books. So it was very hard for me to understand the material because my brain was all over the place. There was too much information coming from too many different areas. So my notes were not organized. So it's very important that you have all your notes placed in one area. Whether you're going to use your laptop, if it's your laptop you're going to use on Microsoft Word to take notes, let that be the only thing you use. If you're going to handwrite it in your notebook, let that be the only thing you use. Don't have notes in your laptop, have notes in the notebook, have like 20 books that you're also reading. It's going to create chaos and confusion in your mind. And so I'll just show a little example of how my notes were organized for like maternity. So you'll see that it was organized by subject. So conception and fetal development, maternal adoption, nursing care in the prenatal period. So this helped me when I had to study for a test, because all the information I needed was in one place. So I did not refer back to any textbook. I didn't have to open up a textbook. I didn't have to try to find the lectures that my professors did. I made sure I condensed all the information in one place, and that was the only thing that I used to study. That was the only source of information. So it's a very important. Tip number 4 is to learn to explain what you have learned. What I mean by that is, if you are able to explain a concept that you have learned, that would let you know that you've actually understood and grasped the concept. If it's memorization, if you only memorized keywords, or you only memorized important things and you don't really understand it, you're not going to do well in nursing exams. Because the way nursing questions are worded, it's difficult to it's not just A leads to B, C leads to D. No. The questions are worded in such a way where you have to understand the concept. You have to understand the material. And then you use that knowledge base to then make a judgment. So if you don't really understand it, it's going to be difficult to answer the questions correctly. Because there are times in nursing exams where there's 2 answers that are correct. 2 answers are correct. And so how would you know which one to pick? So it's very important to really understand the material, to understand the material and be able to explain it. So a lot of what I did was I will record myself explaining. So I will, for example, I record myself explaining how blood flows through the heart. I'll record myself talking about nursing care in the prenatal period. So I'll record myself, so it really helped me, because then it opened my mind to understand, okay, this concept I understand versus this one I still don't get it. So I need to focus in this area. So whether it be you record yourself, or maybe you just explain it to a friend or a family member, but just try to explain the material that you have studied to somebody or to yourself. That would really give you an idea of where you're at. What areas you need to focus on versus what areas you've already got down. Okay? And so after that, my next tip is practice questions. I cannot emphasize this enough. I mean, this was a big thing for me when I was studying for my Nclex. And it's something that I learned way later. I honestly wished I had learned this so much earlier in my nursing education. It would have helped tremendously. The reason I say that is because when I was in school, I had tutors, I would go to professors, and oftentimes we'll go over a certain material and they will tell me okay, you understand this. You understand the concept, you understand the material, you're able to explain it to me. And I will feel confident But then when I go to take the exam, I screw up and I fail. And I'll come back crying because I don't understand why I failed. But later on, I realized the issue was I did not understand the questions. Because I was so focused on just understanding the concept, I didn't do enough practice question to understand how to dissect the nursing questions. Because nursing questions are not like other standardized tests. It's not you learn this and then you just spit that information back on an exam. No. Nursing questions are in such a way where it's testing not only your knowledge base, but it wants to know what you will do in a specific scenario. How would you use your nursing judgment to help a patient? How do you prioritize your work? How do you prioritize patient care? What patient needs your attention immediately versus what patient can wait for 5 minutes? So it's not really just that you know the information, but how are you going to apply what you have learned in these scenarios, in these specific cases? And so I didn't really understand that. So when I would go to take the exam, I would trip up on the questions because I wouldn't really understand what the question is asking me. So yes, I understand the concept, but because I don't understand what the question is asking me, I'm not able to answer it correctly. So it's very important to do practice questions because that gets you used to answering nursing type questions. So whether it be that you have the Nclex books that you can purchase that have the study questions at the end of each chapter, or you go online and Google nursing questions on a specific subject matter, whatever the case is, my advice is to do a lot of practice questions. After you've studied the concept, do questions. Which leads to study tip number 6. My final tip is UWorld. UWorld was key in helping me pass my Nclex. The reason I say this is because UWorld is set up exactly like the actual nursing test, the Nclex exam. It's set up, it's the exact setup. So when you go to take the real exam, you are not overly anxious or you're not intimidated by the setup of the questions or how it even looks, because you will have gotten used to it by doing the UWorld questions. So that's one of the things that I really liked about UWorld, is that it really helped me because I became confident in at least knowing what the exam is going to look like, what is the setup is going to look like when I go for the real exam. And then UWorld also is just question based. So UWorld is not theory based. They're not going to explain things to you. It's question based. So it has about like maybe 200 questions. And so it's very good to practice. And also, if you do get a question wrong, they would explain to you what the correct answer is and why it's the correct answer. So you're not kind of left not knowing why you didn't get the question right. Because there are some, in the notebooks or in the textbooks or some online questions where it doesn't really explain to you why your answer was wrong or why the right answer is the right answer. But with UWorld, it lets you know why your answer is wrong and also what the right answer is, and it explains, it gives you the background, the theory that led to the correct answer. So UWorld was very important to me. How I used UWorld, what I did first when I was really studying was, first I made sure all my information was in one place. So then I was only using one study guide, if I'll put it that way. So after reading through my notebooks, after reading through the Nclex book, I created my own study guide that had all the information that I needed. And I studied that over and over and over again. And I used the other tips, explaining concepts, explaining the subjects that I studied, and just trying to make sure that I understood it. So I didn't do questions right away. After I felt like, okay, I'm more confident in the material, then I went to UWorld and I just did questions. So it's good to first study, make sure you understand the subject, make sure you understand the concept, and then, along the way you can do like little questions, but when you're doing UWorld, do it as, UWorld operates as if it's a real exam, so it's going to time you. So when you're ready to take the UWorld exam, you don't have your notebook next to you. You're taking it as if you're literally at the exam room. It's going to time you. So you sit down. If you need to take a deep breath, anything to de-stress yourself, relax yourself, and then you jump in and it just goes straight. And then at the end, it gives you a report as to what subject areas were your strength, what subject areas were your weakness, so that you know what subject areas to focus your study on. So I just wanted to share these tips. These tips really helped me in the long run. Some of them, I learned them way later on. I wish I knew them earlier. And other ones I used throughout. And I can honestly say that it really helped me. So first, understand your learning style. Purchase an Nclex book, not 1,000 Nclex books, just 1 or 2 would be fine. Keep all your notes condensed in one area. Try to explain concepts to yourself, whether you record it or to somebody else, as if you are the lecturer or you are the professor and you're teaching the classroom. A lot of practice questions, do a lot of practice questions. And if you're able to purchase UWorld, go on their website and purchase it and use that as your practice exam. So I really hope that these study tips helped. And if anybody else has any other tips that will be helpful, feel free to leave it in the comment section. We all want to succeed. So whatever way we can help each other, that's what we do. That's the thing about nursing, is that you can't be selfish. You have to be willing to help out other people, because at the end of the day, we're all working together to help save lives. And so it's not a matter of I know more than you know. If I know something and you're struggling in that area, then it is my duty to help you. So if you have any other tips or any other ideas, feel free to put it down in the comment section. Make sure you like this video and subscribe. All right, bye. God bless you. Bye.